Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Pheochromocytoma. So in the pheochromocytoma, actually the tumor in the pheochromocytoma arises from the chromaffin cells in the adrenal medulla. It mainly arises from the chromaffin cells in the adrenal medulla, and its incidence is seen in 4th to 5th decade of life, and there is no gender predilection. It is almost similar in males and females. There is no gender predilection. It is the most common site of extraadrenal tumor of pheochromocytoma is organ of Zucker candle. This pheochromocytoma is called as 10% tumor. Why? It is called as 10% tumor because if you see, this pheochromocytoma is 10% cases it is bilateral, in 10% of cases it is malignant, in 10% of cases are pediatric cases, in 10% of cases this pheochromocytoma is extraadrenal, and in 10% of cases pheochromocytoma is familial. So we call it as 10% tumor. Then etiology and risk factors and of pheochromocytoma. So in etiology and risk factors of pheochromocytoma, the pheochromocytoma is of two types. It can be either familial or it can be sporadic. If it is a familial pheochromocytoma, this familial can be due to some syndromes or it can be due to non-syndromic. It can be due to some syndromes or it can be non-syndromic. First, we will see syndromes which are associated with pheochromocytoma. Syndromes associated with pheochromocytoma are, we have MEN1 syndrome, MEN2 syndrome, are associated with pheochromocytoma, along with von Hippel-Lindau syndrome, where there is renal cell carcinoma and pheochromocytoma is seen in this also. There is von Recklinghausen syndrome and Sturge-Weber syndrome. All these are associated with pheochromocytoma. Then if you see the non-syndromic, syndromic is MEN2A, MEN2B, von Hippel-Lindau disease, von Recklinghausen disease and Sturge-Weber syndrome. Whereas non-syndromic familial pheochromocytomas, this non-syndromic is mainly associated with succinyl dehydrogenase B and D mutations. Non-syndromic is associated with succinyl dehydrogenase D and B mutations.
thank you and thank you for watching.